Yeah, I've prepared a little slideshow here. Just give me 1 second, turn it on. All right. Okay, so yeah, good morning. My name is Justin. So yeah, Studio 36. I think some of you have visited my place before. I think we held a mixer here once. And I'm sorry, do you hear the ringing? Is that
I
just
just a ding.
okay? I don't. Okay, anyway, yeah, the whole technology thing. My phone connected to my laptop, and I wanted to stop, and I don't know. Anyway, okay, hopefully they won't send too many more messages. Okay. So yeah, I think I recognize some of you guys' faces. Have been to my place at the time. I had just been doing Tai Chi and Qigong exercise classes for the past 3 years, and at the beginning of this year, finally completed a master's degree and got my license to be acupuncturist here in the state of California, and now finishing up some hours towards my doctorate degree, which hopefully will be completed by the end of or middle of next year. So that's exciting. So, I was thinking about what to present today for this morning's mixer, and there's various different topics of my own personal interest, as well as like topics that I think the general public should know about. But then, we have a mixed audience, so I was thinking, well, what is the best way to go about this? And the most common question that I get basically is people ask when to seek acupuncture treatments, and so I thought, well, let's try to address this because there seems to be people are becoming more and more familiar with acupuncture, but the question still remains is like, well, when should I see an acupuncturist? Or the question also is, what types of conditions can acupuncture treat? Now, I know we like to say acupuncture can treat everything, right? In school, we go through the various classes and various discussions and detail of different treatments. And because, well, it's a whole nother discussion, but because we don't actually treat any particular illness or we don't actually treat any particular disease, we treat an imbalance in your body and we look for different signs and symptoms that make up a pattern, and then we treat that pattern. But that's not that's not my discussion this morning. But that would be into how acupuncture works and more about the diagnosis and how we go about our treatment, which is also very interesting. Uh, but so today, what kind of conditions can we treat, right? And so how do I come up with what to talk about? So I thought, well, what are the reasons people go to the doctor to begin with? And with a quick Google search, I came across a study. It was by a Canadian company actually, and I kind of like that because maybe a little bit non-biased, just being our neighbor, and as they did their own research. So they came up with their stats for basically 12 most common reasons for visiting primary care in the US. And so these are in descending order, from the most common to least common. Of course, there's more than this, but I believe this is from 2019. So the first one was hypertension, right? So high blood pressure. Second is URI, so upper respiratory infection, basically a common cold. Number three, depression and anxiety, and then so on and so on down the list. And you just take a moment, you can glance it over. And these are the main reasons people would visit their doctor, throughout the year. So what I decided to do was also just get on the internet and do a quick little search of what kind of studies have been done with the use of acupuncture for treating any or all of these. And of course, due to time limit of this, our mixer this morning, so I just basically looked up the first three. And I don't have all the details for the different cases that had actually been studied, but I did find some things that were very relevant. And so just share with you what the results were with what I found. And so as we move along, yeah, so the first one here, or the first reason, we have the high blood pressure. Okay, and as you all know, it's one of the most common things in America. If not, somebody in your family, there's usually somebody has somebody in their family or somebody, they know somebody with high blood pressure, right? It's a very common thing. But did you know, so this was pretty cool. I came across a study that the American Heart Association, they conducted a study for the effectiveness of acupuncture on high blood pressure, right? And so what they came to was that Yeah, acupuncture appeared to be effective and safe therapeutic modality for the treatment of mild to moderate hypertension. So it's good to know that there are options out there. Now, of course, I'm not here to say anything negative about, pharmaceuticals or drugs, because they have helped a lot of people, and they definitely help a lot of people in this case to control blood pressure. But as we know, a lot of pharmaceuticals do come with side effects. So another thing that we can look at with acupuncture, if we're not helping to address the high blood pressure itself, acupuncture in conjunction with the medications can be also very useful to help controlling the side effects that maybe come along with a lot of the medications that you do take with for high blood pressure. Okay, so moving on, second most common reason, right? We got the common cold. And there was a lot of information on this, and so I just cut it all down. But we have the cold season coming up. It's already August. Before you know it, it's going to be October and November, and it's going to be starting all over again. So as we know, there's tons of over-the-counter medications that people spend lots of money on every year. Some of them work, some of them don't work, but if you do a quick research, a lot of the results say that as much as they may, hold you over on a, day by day, like none of them actually reduce or shorten the length of your cold. We see that it says many people, the physicians, they write so many prescriptions for antibiotics, and antibiotics is for bacterial infections. Common cold is from viruses, very common viruses, and that for the most part we're able to take care of with our body's immune system. So there should be no need for antibiotic prescriptions. And then the research also says that vaccines for flu, only about 40 to 60% actually prove effective. So there's a lot of things that we try to do, right, to minimize our duration of our cold and to reduce the effects of our cold. But really, the main thing is a strong immune system is the only thing that's going to really help get you through your cold faster and also prevent your cold. But however, in the event that you do catch a cold, studies show that acupuncture can reduce the fever from a cold in just one treatment. And then there was a study in South Korea where I think there's 150 participants in the study. And the first half went in for their acupuncture treatments within the first 36 hours of their cold. The second half went in at the end of the other 36 hours. Both participants, they showed shortened duration of their cold, but the ones who came in sooner, they had a better effect, and the symptoms were shortened a lot sooner than those who came in later. So if you do have a cold, coming in for acupuncture at the beginning of your symptoms can help reduce the duration of the cold and also minimize the symptoms that you face. So without the need for the over-the-counter products. And we look at the third case, right? Depression and anxiety. And I think this one is actually one that I don't know if they refer to. I mean, I know heart disease they refer to as like a silent killer, but I think also depression and anxiety is something that people don't talk about because nobody wants that to be known. I mean, of course, whatever things you suffer with, but a lot of people with depression and anxiety, right, they suffer alone. And especially in the times we have going on now, we got COVID and all these things, people out of work, jobs, socialization is at, to a minimum, right? There's a lot of depression and a lot of anxiety with the whole current situation. But acupuncture can help, and not all depression is the same in terms of Chinese medicine. And we look at the different symptoms that each individual faces, and then we put together a treatment plan to help relieve those symptoms of depression. For my own self, I do have a couple cases where together with acupuncture and Chinese medicine was able to help somebody who was dealing with mild depression and also anxiety. It was also during a time of final exams for this in particular individual. And she came into the clinic, and with acupuncture and with some herbs, we were able to reverse those effects. She came in the next week saying how she felt great. She went through finals, or I don't remember, it was midterms or whatnot. but the anxiety that she had previously had felt was not there. She felt great. She was able to sleep, able to get through her exams, no problem. So it was great, and so it can work for sure. So yeah, and the one thing I just want to let everybody know that not only with the depression, all the pharmaceuticals, so it never has to be just one or the other. If we are able to reduce the amount of drugs that people are taking because of side effects and long-term health effects of some of the pharmaceuticals, then that's great. But like I did say, a lot of the pharmaceuticals have helped a lot of people, and a lot of people do need them. So acupuncture, in that sense, definitely can be useful for countering some of the side effects that do come along with the various different medications. So that is something definitely to consider, right? It never has to be one or the other. So I think now in the modern day, Western medicine definitely has its benefits and its uses, but we can look towards Eastern medicine with the acupuncture and herbal medicines and see which things that we're able to maybe slowly wean off and then rebalance the body, so we don't need to be so heavily reliant on those types of medications. Let's see. Yeah. So before we get to the end here, the next most common question is, does acupuncture hurt? That's what everybody wants to know. So before I answer that, let's take a look at a picture here about the size of our acupuncture needles. Now this picture is not to scale, okay? This is not a scale photo of of the needles, but everybody's familiar with what a tip of a match looks like, right? And so here we have a good comparison. So we have a match, a typical hypodermic syringe needle that you'd see for injections in the hospital, and then a sewing needle, right? So an acupuncture needle is a quarter the size of sewing needle. And we do have various sizes for acupuncture needles, but generally speaking, that is a common size that we do use. So does acupuncture hurt? Generally speaking, the answer is no. But there are different feelings and associations. Once we do insert the needle, we do some minor manipulation and to try to bring out what we say is the qi, or this arrival of qi, or this arrival of the energy. And then usually what the patient will experience is sometimes like a numbing feeling or soreness or a little bit of pressure. Sometimes that arrival of that sensation can come on a little bit fast, so it can be a little bit startling. But also depends on the sensitivity of the individual. So is it painful? No. But are there feelings and sensations associated with it? Definitely yes. I mean, it would be not right of me to say, oh, it's totally painless and like you never feel anything, but that's not true. But is it painful? No. But there are some feelings that do come along with it. And yeah, and they're different for every individual, depending on your case, depending on what kind of things you're experiencing. And people with, like, say, severe, chronic back pain or something like that, the insertion of the needle, there may be like this, I wouldn't say pain, but a strong sensation. But for that person, that sensation is a sensation of relief. Like if you've ever had a massage and like your muscles are really tight, and then somebody presses down on it, it's like one of those kind of like a good hurt where it's like, that doesn't, it's not, it's not somebody, a nice smooth feeling, but yeah, at the same time, it's a release of tension that's been built up. And so, yeah, you can have this types of sensation. Yeah, so here wrapping up, we see that acupuncture on its own or integrated with other conventional modalities is proven to be effective and safe treatment for different conditions that we see in the primary care setting. Basically, that's the end of my presentation, and to kind of keep it short and sweet. But I do want to just jump back here and mention one thing that I didn't mention. Regarding the colds and flu, for example, I mean, and I didn't really want to bring up COVID per se, but it does fall into this category. But let's not talk about COVID, but just, if you do find that you yourself do catch colds or more susceptible to flu than, say, other people, say you have like a cold like every maybe 5, I don't know, more than 2 or 3 times per year, right? So looking at acupuncture to treat the symptoms is one thing, but another thing you definitely want to look at is boosting up the immune system. Using acupuncture and Chinese medicine uh, fantastic for boosting the immune system, right? There's studies on this that go, you can find this very easily, use of acupuncture for increasing the immune system. So for prevention of colds and flu, yeah, acupuncture and definitely herbal medicine is something definitely worth considering, because that's something that, over the counters can't really do. I mean, of course, you can take your vitamins and your vitamin C and whatnot, but zinc and different things. But when it really comes to the boosting the immune system, acupuncture has really been proven to be very effective at that. And then we also use in conjunction with another modality we call moxa. We burn a certain type of herb over certain points of the body, and it has been proven to really boost the immune system. Oops, let's go this way. Yeah, so basically that is it. So if there's any questions, if anybody has any questions, I would be more than happy to do my best to answer for you.
I think my computer keeps falling out, so if you guys miss me talking, just know that that's why.
Yeah, no, you're there.
Okay, good. It froze on my end for a minute. I didn't know. That's great. That's actually a lot of helpful information. So I have a question actually, and we'll open it up to questions for everybody else. So you're talking about like it helps build up your immunity. So somebody, so I know some people in my family who have low immune systems. They get sick very easily. So if they were to do start doing acupuncture, or is it also with a combination of herbs, would that help build up their immune system stronger?
Yeah, well, I mean, if it's just, see, that's the thing, everybody's different. Everybody has their own unique issues, let's say, right? I mean, there's no one treatment, right? So I mean, we do have a point per se that is like noted for boosting and increasing the immune system. But generally speaking, if a person's system is unbalanced, yeah, we need to look at balancing it. So I mean, one person may be more suitable for taking some herbs. Another person who is generally already quite healthy. Okay, my mind is going in different directions because I was looking at something just as you mentioned this, and I wanted to point out about how in a lot of the news we hear about people who were like generally, really fit, exercise a lot, blah blah blah, and then they got COVID, and then they're in the hospital and they get really ill and whatnot, and then they say, well, this person was healthy, but just because we're let's say physically strong on the outside doesn't necessarily mean we have a strong immune system. Okay, but anyway, to answer your question, yes, acupuncture with regular acupuncture, and then not necessarily herbs. It would need to depend on the individual, but acupuncture in general, together with moxa. And actually, the moxa is something that you could do at home. We have it comes in different forms. These little sticks, and you burn it, and it's like a herb. The herb in English is called mugwort. Yeah, maybe you've heard about it, maybe not. And it's dried, and then you burn it in the location on the leg. And then I've showed some of my students who come in here for the Tai Chi class, like where this point is. And then, yeah, we burn it, and then you burn it on a regular basis. And then it's been proven to increase your immune system. So for myself, I never personally had that issue, but my professor in the university, she said she used to be the person who would like catch cold, like, 5-6 times a year. And then she started putting herself on a regular routine of burning the moxa, not even acupuncture. So, I mean, there locations on your body with different modalities can help to stimulate this effect in the body. And she would burn the mugwort on her, there's a lower part on your lower leg. And then she would burn it on there, like, I think at the beginning of the month, just for like 5-6 days consecutively. And then that was it. And then her immune system just boosted up. She like rarely got sick anymore, and nothing else changed. This is just the only change that she had done in her routine. So yeah, I mean, with people that are close to me, I've seen the effectiveness of using these type of techniques to ward off cold and to improve the immune system. Exactly.
That's really great. Yeah, because a lot of times people who they just kind of, they decide that they have to live with that. I have a low immune system. And so it's nice to know that there are ways that could possibly help them.
Yeah, well, I mean, and also, there's no, we need to take responsibility, for our own health. And what I mean by that is that sometimes sometimes within our control, sometimes without our control, but stress due to lifestyle, stress due to things around us, right? So I mean, obviously there's things that go around that we are really not in control of, but there are other things that we can control, and we can try to remove ourselves from certain situations if we have the ability to. And then also looking at diet, so a lot of these things as well, lifestyle and diet, will have a contributing factor to your immune system. If you have like a lot of high stress and this kind of things, and you eat a lot of foods that are high inflammation types of foods, also your immune system will be lower. But generally speaking, you say, but I exercise all the time and I'm relatively fit, but you still have different things going on that you don't really associate and put this together with, and so it will affect your immune system. So yeah, so even if you are doing the acupuncture, it will help, but still there's other things that we need to look at. We also need to look at everything as a whole all the time to make sure things stick, right? Because things didn't get a certain way for no reason. Like, I mean, of course there are times where people are born with certain situations and whatnot, so we definitely can't discredit that. But relatively speaking, for other healthy individuals, just things building up over time with lifestyle and different things and diet, and then eventually they just start adding up, and then we don't realize the effects that are going on with our health until it becomes something serious. Because usually also what happens is things start to build up, a change happened, but it was small and you probably noticed it, but it didn't really affect you, and you didn't really have to change anything in your lifestyle. So then as time goes on, that becomes your new normal, and then you don't realize it anymore, and then time goes on, and then things start to add up again, and then maybe something small happens again, but then that becomes your new normal, until finally things add up, and then eventually something shows up. And then so what Chinese medicine tries to do is catch it before, or at these levels where things are being stacked up, and start to peel them off and try to find out what's been going on before something shows up. Yeah,
that's
so
good.
that's actually, I get excited about talking about it, and then I start thinking about other things, and I just start sharing it. But so if you don't mind, just what's interesting about Chinese medicine versus Western medicine is that Western medicine, which is really good, but when something shows up, it's there and they can test it, and then and there's labs for it. We can do biopsies and this kind of thing, and then we can get results. But like I had just mentioned, as time goes on, little things add up, and maybe you notice that at first, but then like it becomes your new normal. Or maybe when it first comes on, you go to your doctor and you say, hey, geez, doc, recently I've been, I don't know, having some such and such symptoms. And then everybody's got that, everybody, that's normal, but you're like, but I never used to have that before. And then, they check your blood and they do the test, and everything shows up fine, because there's nothing wrong. Everything's within limits, but your body, and it because something changed. And then, okay, whatever, doc says it's fine, and I still feel fine. And then you move along, and something else happens, and then the same thing happens, and you go back to your doctor. And it's not until that it has added up to a certain point where now it's testable. Oh yeah, it shows up. Yeah, you definitely do have an ulcer in your stomach, but all the while you knew something wasn't right, but nothing could show up because it wasn't testable. It hadn't reached that level. I mean, but what Chinese medicine does, which is pretty awesome, is that all of these things that you experience, regardless of how insignificant you may think they are, they're all little pieces to a puzzle. And each little piece, the more that you tell myself or an acupuncturist, the more information you tell, the more little pieces to a puzzle that we get. And then we try to put these pieces together, those pieces together, and then we create, patterns. And then each pattern is basically a diagnosis for something. And so, although as it may not show up on a lab results or on any sort of test, but it shows up as a imbalance somewhere, whether it's just low energy or whatever, and then you have a deficiency, we say qi, or if you're feeling like hot in the afternoons, hot in the evenings, you don't know why, and you're only like say 35 years old and female, it's like, I'm only 35, it definitely is not why am I having these like hot flashes, it's definitely not menopause. But like, so you're not having menopause, you're too early. But it's like, well, I'm feeling hot and I've got all these symptoms, like what's going on? And then they do all these tests and like nothing shows up. But then later down the road, something happens. But the point is that you explain those feelings to an acupuncturist and they mean something to us. It's like, yeah, you shouldn't be feeling that. Or because a large percentage of population may feel these kind of like heat symptoms in the afternoon or in the evening or whatever, then, well, then you're not the only one. You know, I have a lot of patients that have that, you know, but it's fine. You do your test and nothing shows up. So it's all good. But it's not. You shouldn't feel that way, right?
I have a question, Justin.
Yeah.
What about would acupuncture help with psoriasis?
Yeah, well, not only acupuncture, but then a lot of like dermatological conditions, herbal medicine is fantastic. And actually, well, I have a couple pictures. It's not psoriasis. It was actually shingles, or like herpes zoster, if you guys want to see.
Yes.
She had given me permission to use the pictures for a previous thing I had done. Yeah, let me see just real quick. Give me 1 second.
Hi, Doug.
Hello, Marilyn. Good to see you. And Michelle.
Good morning. Good to see you.
Sorry I'm late.
No worries. Better late than not at all.
Give me 1 second here.
No worries.
Here we go. Okay.
My husband suffers from psoriasis, and I don't use the word suffer lightly.
So it must be pretty severe then. So, like I said, so this obviously, can you see the screen?
Yes.
Yeah, so this is not psoriasis, but you know, shingles and upper here near the eye as well. And so it's pretty severe. So like, you know, this person had like burning, stinging pain on the side of her head and these blisters that were filled with pustules, and the eye was really swollen and fever. The whole area was hot. It's pretty severe. Now, she was also taking some Western medication for it as well. But let's see if the next picture will be after. So this is only like, if I'm not mistaken, 3 days, possibly 4 days later, all of the blisters had dried up. The swelling had reduced like considerably, and the pain was gone. And then she was just dealing with the, you know, drying up of the, you know, of the blisters. Now, my father's an optometrist, and actually I had brought this case to him and told him, because I like to share things with my family, you know, to get them interested in herbal medicine and Chinese medicine. And he had actually told me that just a few days before, they had somebody come into their office with shingles also on the side of their face. And then, so I showed him the results from the herbal medicine. And like I said, she was also taking Western medicine as well. But so within less than 5 days, she went from swollen, painful, pustule blisters and red, you know, to less than 5 days. It was pretty much like tolerable. The swelling was down, the redness is down, the blisters were gone. And then my father was like, he was pretty impressed, because he's like, yeah, he's like, our patient didn't recover, you know, that quickly, like that person had done. So as far as, like I said, I don't have any pictures for psoriasis, for example, but yeah, dermatological issues, definitely herbal medicine and acupuncture can be very beneficial.
Okay, thank you.
I have a question,
Fine.
Justin. Hi. And it's probably coming from a place of my fear of shots. I mean, sharpened steel, you know, I am stuck into my body. It just puts me on edge. Have you ever had any patients that had negative side effects from acupuncture?
Well, probably the most common thing is maybe it would be like fainting from putting the needle. Even myself, I fainted once. I have to admit, I fainted once. But I was also sitting up in a chair, and this was during back a couple years ago when I was still in school. And so, to be honest, I'm a very, very paranoid, and I want to make sure that whoever's doing anything to me knows what they're doing. And I specifically look for 2 of my classmates who I trust, but yet at the same time, my mind is, you know, overthinking and getting very anxious about what was going on. well, not, that's not true. Well, that together with, it was like a cocktail of things, that we had just done some exercise and I hadn't eaten. And so it was a bunch of things all added up together. And then we did a couple of needles because I had some tightness around my neck. And then as I put some needles in, I fainted. And, but you know, if that does happen, you know, just like as if anybody faints, we follow the basic procedure. Of course, we remove the needles immediately. We lie, normally speaking, the patient is already lying down, but of course, then we'd elevate the feet. And then just as anybody faints, you know, you come back quite quickly. Um, but as far as the most common thing that would happen, definitely would be that. Other side effects that happen is maybe there's some bruising in the area. Every now and then there'll be some little bit bleeding in the local area. You can be left with a bruise. Sometimes the area where the insertion of the needle will be a little bit tender or sore for a few days afterwards. Those would be the more mild side effects. I mean, then it is common, not common, definitely not common. I don't know why that came out of my mouth. But another side effect, there is some slight danger when it comes around into the chest areas and where the lungs and such like that. But generally speaking, those areas in my practice are avoided. And then when we do needle around the neck and the back, I use the shorter needles, and then the needles are always inserted at a flat angle, definitely never in a perpendicular angle. So we do take all safety precautions where in the vicinity of you know, vital organs and such. But generally speaking, otherwise, most needles are in the leg, in the arm, in the hand. And of course, there's nothing to be of too much concern in these parts. But I have to admit with you, in going into this profession, I was definitely afraid of needles all growing up. I mean, I think when I was a child, I probably fainted at least twice getting a shot, once in the butt. I remember fainting on the table. And then I used to have my father and nurses hold me down so they can give me a shot. Like, I mean, I hated needles, and I mean, I still do. I think I can probably go get a shot in the arm now, but I mean, I hated it. Well, then since we got on this topic, I'll share with you my first my first acupuncture experience. So I was living in China. I lived in China for about 12 years, and I started learning martial arts. And so my teacher, he was also an acupuncturist. He self-taught, and he would give people like Chinese body work and do acupuncture. So one day, and I'm about maybe 28 years old at this time, 42 now, so that's some time ago. So 28 years old, so relatively healthy, right? You know, good, you know, young still. But I pulled my back. I don't know what I did, but it was something stupid. And usually that's how it does happen, right? You bend over and you get your keys or whatever, and then you just came up wrong, and then you're like, oh, and then you just can't walk, you know? And this was bad. Like I couldn't sit down, I could barely walk, and it was bad. So I was scared of needles. I had not tried acupuncture yet. So my wife said, well, go call your teacher, go over to his house and see if he can help you. So I said, teacher, can I come over? You know, I hurt myself. He said, hey, come on over. And I was hoping that I would get like body work done because I did not want needles, right? I was like, please don't use acupuncture. Please don't use acupuncture. So I get to his house, and so people would come to his house like all the time for treatment because he just treated out of his house. So I got there, and there's already about like 3 or so other people there. So I sit down. He tells me to sit down. And generally speaking, after you just come in from outside, so you should rest for a while, let everything kind of calm down before you do any kind of treatment. And then he comes out with a couple of needles in his hand. And then immediately I'm like, shit, you know, like I was like, this is not what I wanted. It's not what I wanted at all. But I couldn't leave. You know, I couldn't leave. There's already people there, and I couldn't make up any excuse and just be like, all right, I gotta go, you know. So I sucked it up, and I'm like, all right. So he tells me to relax. I'm like, yeah, of course. And so the first needle, and then out of all places, the first needle is right here.
Oh.
So of all places, right? I mean, like not even on like on my butt, like a place where there's lots of meat, you know, but like right here, I'm like, oh man. So, you know, and he's like, don't move. I'm like, yeah, don't worry. And then, you know, he puts the needle in, and then to be honest, like the insertion, it was painless. But then once the needle was in, a little manipulation, you can feel some kind of pressure. And it wasn't uncomfortable, but it's just not something that you're used to. It's like this kind of unusual feeling. So he manipulates it a little bit, twisting the needle. Okay. And then seriously, like to sit down, for me to sit down was like, like one of these, like I just could not move. He manipulates the needle. He tells me to get up and try to bend over. I immediately can just stand up, bend over, squat, touch my toes, sit down, squat, like as if nothing had happened.
Wow.
And then he gave me another needle on the side of the hand. And then I sat there for about like 10, 15 minutes with the needles in. And then I left, and I had gone in with excruciating pain, zero mobility, from the pain in the lower back. And after just these 2 needles, I wouldn't say it was 100% better, but let's just say like 90%. I mean, there was still like a little bit of discomfort that you could feel in there. And then for the next 3 days, basically it was like good to go. I could have gone back like 3 days later because I could feel it starting to creep up a little bit, but it wasn't to the point where I could not function, and I didn't really want to go back at that time. So I didn't go back. But had I gone back for a second treatment, I think 3 or 4 days later, then it would have been like golden, like,
Wow.
like right off the bat. But I didn't, like I said, I wasn't personally at that time in my life. I didn't really want to go back for a second time, but it was okay. It was enough. Let's say like when I left the place, I was 90% better. After 3 days, it kind of went down to like 85, 80, like kind of creeping up a little bit, but then it was fine. And then I was able to go on with my week. Yeah, that was my first.
Amazing.
Good story. Yeah, that's
It's
good.
a great testimony.
Do you treat yourself?
I do, depending, but I think it's difficult to treat yourself. It's difficult to treat yourself. Sometimes I have success treating myself. Sometimes not so much. Yeah, and I think you kind of need that reciprocation of another body to an assistance with your energy, your chi. Is useful.
That makes sense. Yeah.
Because I mean, if you yourself are lacking in something or deficient, or you've injured yourself, there's an injury or a blockage to your own chi, your own energy. So it's kind of difficult to affect your own chi in a positive way. But so that's why, for example, as a practitioner, it's very important that I do particular exercises to make sure that my energy is strong, so that when somebody comes in, that with the needle, I'm able to help to manipulate or to unblock or to move the energy of the other person to help get them better.
Love that.
Thanks for that.
Yeah.
Does anyone else have any questions? I know we're getting close to 9 o'clock here.
Oh, geez. Sorry, but that was fast.
Oh, no, don't be sorry.
No, it's
That's
good.
what we're here for. Anyone else?
If you don't mind, I'd like to just mention a case that just recently came in, because I think this is quite common amongst more people within the community, not necessarily on the list that I had, but lower back pain, right? I just want to just briefly mention about lower back pain because it's quite common. So I had a gentleman come in with lower back pain, and the reason for coming in is pain, and this is the main common reason most people like to come in, is they've heard acupuncture is great with pain. But so what's important about this situation is that to go through a very careful diagnosis with all, like I mentioned earlier, all the little puzzle pieces to put together a pattern. Because in this particular case, it wasn't just the fact that this person had back pain. There were some other underlying conditions that contributed to the fact that he ended up with back pain. So now, of course, with the needles, we can immediately start getting some relief in the lower back. But through the discussion, learning, and through, like poor sleep and feeling warm in the evenings and just all these different little things that add up. So it leads me to see that it was like, well, you have back pain, yes, because you lifted something, but yes, because the chi or the energy in that part of your body is not strong, which is where your kidneys are. And so he ended up also taking some herbal formula to help internally boost up the function of the energetic function of his kidneys in the region. And after 3 weeks, came in for back pain, and not only did we help with the back pain, but his sleep improved, his mood improved. He said that people around him were asking, like, what did you do? Like, you're like a lot more pleasant to be around than, before. And, so you come in for one thing, and then with the complete discussion, we can see that, yes, you have the pain, but there's all these other things that we don't necessarily tend to associate one being related to the other. And so we just need the back pain treated, right? But then there's all these like deficiencies and imbalances in the energy of your body that are also the reason for the fact that your back is not strong enough and that we're more susceptible to getting injured. So with the acupuncture, and also maybe if the situation fits the case, some herbal medicine to help internally supplement that deficiencies within the body, and then with the acupuncture, and then 3 weeks later, back is great, and then also a more pleasant person to be around, and his sleep improves and all sorts of other things. So yeah, it's pretty interesting.
Yeah, and I think that's what I really appreciate about Chinese medicine and acupuncture and the herbs and all that is that, with you look at the whole picture. It's not just, okay, you have this pain, here's some opioids you can go take, and they'll just numb it until you feel it again, and then you'll take another one. You're looking at the whole package, the whole person. And that's something I know I personally definitely appreciate about what you do. I think it is important. That's nice that you're putting the message out there and that you all attended to learn
Yeah, I
that
really
as well.
appreciate giving me the opportunity to speak about this. Yeah.
Yeah,
I
absolutely.
I have a quick question.
Sure,
Yeah.
Jay.
My mom had shingles on her arms,
Mhm.
and so if she were to go in there, I mean, because the pain just lasts for years with her, so if she goes in there, like, what would be like a typical, okay, I feel a little bit better now? And do you do a lot of shingle patients?
Personally, so we were not open for the past 2 months due to the COVID, when they first got big. So we also kind of shut down for a while. But I'm also, as far as seeing patients for different cases and such like that, we're only since the beginning of this year. So yeah, but I've seen some. But so what your question is regarding the procedure, or what would she expect when she comes in? Is that what the question is?
Yeah, like a turnaround for her to say, okay, the next day after I did it, I feel better, or does it? I know you mentioned sometimes it takes a few weeks, maybe.
Yeah,
And
well,
then,
so something like that, right? So, you have the shingles, you have like this viral virus that's like hiding in the body. I mean, because then it just comes out, it goes dormant, and then it comes back out. And when you have like an attack, and it comes out and it's really bad, and then it goes back dormant again. When the acupuncture, right? We can use the acupuncture, and also a lot of times with shingles as well. Something that we do is another technique we call bleeding, and then we'll use just like a lancet, or also just the acupuncture needle, and then we'll do some small pricks around the side, because usually there'll be like some red inflammation and things around the skin. And so this is a really interesting topic, but to make a long story short, when you're cooking something on the stove, right, you're boiling a soup, and you've got the lid on it, right, and it's getting hotter and hotter and hotter, right? The steam's building up, it's starting to bubble up. So what happens, right? It boils over. But when we have this kind of viral infection in the body, we've got this heat. And so that's like one way that we use to describe this kind of pain, like this burning pain. And you have this redness. Fire's red. So red means heat, it's hot, and it's burning, and it's itching. So by pricking the skin to kind of, let's say, open up a top to let some of the steam out. So this is one way that we use for, in this case, like with these shingles, is we prick some spots around the site that's being inflamed, or that's being affected, and to let out some of that steam. So when a little bit of that blood comes out, it's like opening the top of a pressure cooker to let some of that steam out. So that would be one thing that we'd consider. But then also acupuncture around the area, right, and that would help reduce the pain. It's difficult to say, you can't really say any one person would be like, after one treatment, how you would feel. But some people respond faster, other people respond slower. But definitely with a combined treatment with acupuncture, and then also we use herbs specifically for dermatology cases, and also in that case we have a lot of herbs that do have a lot of antiviral properties that would really go in to help try to clear out the virus. Now, we can talk about it like that, but that's not the way that it classically that it actually works. But just through modern research, we do know that a lot of the herbs have antiviral properties. So we'd go in there to reduce the inflammation, clear out the heat, we'd say toxicity, and to relieve the pain. And people do. And we could also prescribe some topical as well. The picture I had showed with the lady with the eye, had given her a few herbs to cook to make a topical decoction that she could put on the infected area, as well as taking herbs internally.
thank you.